transgenderism, gender dysphoria, and gender affirming care. Chances are we've all heard these phrases before, but today the effort to normalize these beliefs is more prominent than ever. And with progressive agendas specifically targeting our youth, it's no wonder kids have become confused about their identity. This topic is very close to my heart, especially after actually meeting a detransitioned woman named Luca at a medical conference. The advice given to her as a struggling teenager only encouraged her confusion and eventually led to the permanent disfigurement of her body. In honor of her story and those of so many other victims, I want to shed light on this important topic by speaking about what gender dysphoria is, the modern solution to these issues and the harmful consequences, and lastly, what is an effective approach to helping such individuals. So, what exactly is gender dysphoria? According to the American Psychiatric Association, gender dysphoria, quote, refers to psychological distress that results from an incongruence between one's sex assigned at birth and one's gender identity, end quote. In other words, it's a disconnection between the child's biological gender and the child's subjective self-perception. For decades, this condition has been recognized as being disordered. In fact, gender dysphoria studies date back before 1949, as reported by the APA. At the time, it was referred to as gender identity disorder, or transsexualism. The term gender dysphoria wasn't introduced until 2013, when the American Psychiatric Association first used the term in an attempt to eliminate the negative stigma surrounding the condition. Since then, many have continued to only dangerously disassociate any negative meaning to gender dysphoria. Today, questioning one's gender is not only normal, but encouraged. In her book concerning adolescent gender dysphoria, Miriam Grossman, MD, said, quote, over the past decade, the incidence of gender dysphoria has increased 5,000%. And according to the Williams Institute at UCLA School of Law, an estimated 300,000 individuals between the ages of 13 to 17 now identify as transgender. With all that in mind, what is the modern solution to gender dysphoria? Today, doctors are using gender-affirming care as the immediate course of action. This is clearly a corrupt way of thinking because you would never, for example, affirm or encourage a suicidal person to commit suicide. Likewise, why would you ever encourage someone to embrace their gender dysphoria? However, that is exactly what the trans movement does, glamorizing and blatantly ignoring the fact that these children are suffering from a mental disorder. As defined by the World Health Organization, gender-affirming care consists of medical intervention to enhance someone's felt gender. The AAMC explains puberty blockers are medication to prevent the production of sex hormones and pubescent development. Another option is hormone therapy. Unlike puberty blockers that prevent naturally occurring hormones, hormone therapy provides large amounts of hormones that would have never been in the body otherwise, such as estrogen in biological males and testosterone in biological females. Both are intended for these children to develop sex characteristics that reinforce their disordered feelings. Surgery, being irreversible, is clearly the worst option. According to the National Library of Medicine, over 3,500 patients between the ages of 12 to 18 underwent gender reassignment surgery from 2016 to 2020. These include breast procedures, facial and cosmetic surgery, and genital reconstruction. Now, while the doctors behind these procedures claim they're doing good for these kids, the evidence says otherwise. Ryan T. Anderson, PhD, states, quote, parents are told that puberty blockers and cross-sex hormones may be the only way to prevent their children from committing suicide. Never mind that the best studies of gender dysphoria show that between 80 and 95% of children who express a discoordinate gender identity will come to identify with their bodily sex if natural development is allowed to proceed, end quote. Telling a parent that their child will kill themselves unless they allow them gender-affirming care is not only grotesquely manipulative, but simply false. In truth, high suicide rates aren't seen in kids denied gender-affirming care, they're coming from those receiving it. A 2011 study conducted in Sweden following patients post-sex reassignment surgery reported a completed suicide rate 19 times higher than that of the general population. In 2020, Richard Brandstorm, PhD, performed the first total population study of 9.7 million Swedish residents, which showed that compared to the gender dysphoria population as a whole, those who received gender-affirming care were about 6 times more likely to have a mood disorder, more than 3 times as likely to have been prescribed antidepressants and analytics, and more than 6 times as likely to have been hospitalized after a suicide attempt. With so much evidence exposing the harm of these procedures, how does the trans movement convince patients to go through with them in the first place? By presenting flawed and weak research. Dr. Miriam Grossman describes the basis for prescribing this gender-affirming care, stating, quote, "It rests on one small study done in Holland 30 years ago with only 55 subjects. The primary entry requirement was severe gender distress from early childhood. The subjects were given puberty blockers, cross-sex hormones, and occasionally surgery. After 18 months, some subjects reported modest improvement. The study had no control group and was never replicated. So for those and many other reasons, it's considered seriously flawed and unreliable. The Dutch protocol was never intended to be the basis for helping all individuals distressed about their sex. But that's what's happened. A tiny, defective study became the basis of gender medicine around the world," end quote. No matter the intention, continuing this reckless ideology does not have children's best interests at heart. Evidence shows there is a better strategy to help those struggling with their identity. As it turns out, there's more to gender dysphoria than initially thought. According to a 2018 Kaiser Permanente study of 8.8 million members in Georgia and California, high rates of psychiatric disorders and suicide ideation exist before the initial presentation of gender noncongruence in teens. Not only that, but gender dysphoria is almost never the only condition patients struggle with. In a 2021 prospective study from a multidisciplinary gender pediatric service in Australia, high rates of mental health disorders exist with anxiety and depression in over 60%, behavioral disorders in 35%, and autism in 13%. The study also reports negative childhood experiences with family conflict and parental mental illness in more than 60% of individuals and bullying in 54%. According to the clinicians, one of the key challenges of this study was untangling the gender dysphoria from comorbid factors such as anxiety, depression, and sexual abuse. So, what does this all mean? These kids have a multitude of underlying conditions contributing to the gender dysphoria. Doctors themselves are having trouble differentiating what is gender dysphoric distress and what is not. If we can find the root cause of the problem, we can then treat the patients appropriately. The CAST review is credited as being the most comprehensive review in gender-affirming care yet. It was newly commissioned by the National Health Service in Great Britain, in which Dr. Hilary Cass analyzed data from England's Tavistock Gender Clinic, the largest in the world until it was shut down just last year. Her report demonstrates the sheer lack of evidence of medical intervention benefiting kids with gender dysphoria and does not advise gender-affirming care as the immediate course of action, stating, quote, "Standard evidence-based psychological and psychopharmacological treatment approaches should be used to support the management of the associated distress from gender noncongruence and co-occurring conditions," end quote. Dr. Cass concludes, the best and most appropriate treatment to administer to gender dysphoric youth is counseling. And we're not the only ones calling for better care. According to Dr. Miriam Grossman, when speaking for PragerU, multiple countries have put a nearly complete stop to the treatment of teens and instead are focusing on their mental well-being. In fact, a 2024 report in France described sex reassignment in minors as potentially, quote, "one of the greatest ethical scandals in the history of medicine," end quote. In conclusion, gender dysphoria is disordered sense about one's gender and a major issue in our society. And the use of life-altering puberty blockers, synthetic hormones, and surgery is clearly causing more harm than good. I will never forget when Lucas said all she really needed was someone to listen to her. Therefore, we must educate ourselves to better educate others, work towards promoting good legislation representatives, but most importantly, be ready to lend a compassionate hand to whomever may need our support, ensuring they receive only authentic care. We must do everything we can to prevent any more innocent children from being irreparably harmed. Thank you.